Hello everyone, welcome back for another interesting video. Today we will explore a product named Luliconazole Cream. It is used to treat fungal infections such as Tinea pedis, which is athlete's foot infection, Tinea cruris, which is jock itch, Tinea corporis, which is ringworm's infection. How to use: apply a thin layer at affected area. For athlete's foot infection, the duration is 2 weeks and use it once daily. For jock itch and ringworms, apply it once daily for 1 week. Must complete the course. Don't wrap or bandage affected area. When not to use this cream: first, if you have any allergy to this product. Second, if you are pregnant or breastfeeding. Third, don't use it at open wounds or damaged skin. Avoid using at sensitive areas like mouth, eyes, at any mucous membranes. If, after completing the course, if infections still persist, consult your healthcare physician. Please note, this is antifungal cream. It will not help against bacterial or viral infections. If you like my work, please subscribe the channel and let me know about your feedback or questions related to health and medicines. Thanks.